Hello everyone, today I'm going to talk about large intestine 4, which is a very common point that we use almost on a daily basis in acupuncture. There's a couple of variations on how this point's located, and I want to demonstrate what that might mean based on the clinical anatomy. Okay, in the web space here we have the first dorsal interosseous muscle. You have oblique fibers that come right off of the second metacarpal. You have parallel fibers that come off the first metacarpal and attach to the phalanx of the index finger. So one location that we use is in those oblique fibers. Another location that you see practitioners use is in the parallel fibers. If you come off those parallel fibers and you use the Baucher point, you would go past the first dorsal interosseous and you would hit the adductor pollicis muscle. And I'm going to demonstrate that right now. Okay, so the traditional large intestine 4, going halfway between the second metacarpal. Watch out for the branch of the superficial radial nerve here. You can push in with your fingertip and roll up against the bone and try to feel for a click here. And the nerve is very small. It takes practice to feel it at this location, but we don't want to needle directly right into that spot. Okay, so we're coming right off the nerve into the muscle belly. And this is also a common area for a trigger point in the first dorsal interosseous. So when you needle into this area, you might see the finger twitch if you hit a trigger or a motor point in this area. So you can work the needle a little bit and see if there's anything in there. It's pretty clean. There's a little twitch right there. So we hit one of the trigger points. And then if you go into the other area here, the second location, you might also find some trigger points or sore spots in this area or reflexive twitches, which we don't see in this particular location. And then if you go underneath it, here, into the Baucher point, you'll be in the adductor pollicis. So I'm just going to go back and just gently stimulate those points so I can demonstrate the movement and the effect that it has on the index finger and thumb. So if we go to the traditional large intestine 4, you'll see the index finger abduct away from the middle finger as that dorsal interosseous is stimulated. Here's the other one here, same thing. And then if you go into the adductor pollicis, you see that thumb adduct, which is moving towards the palm of the hand. Let me turn that up a little so you can see it a little more obviously. So same region, 3 different locations, 3 different actions on muscles innervated by the ulnar nerve. So as you can see, when needling any acupuncture point, intention is really important. And simple points like large intestine 4, a few millimeters or a centimeter left or right can make a big difference. So really, when you're treating an area, you want to know what's underneath the skin, and hopefully now the next time you needle large intestine 4, you'll keep this in mind and be able to apply it in your clinic. Thanks for watching.